Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Spina bifida is a developmental and congenital condition in which some vertebrae over the spinal cord are only partially formed, with the result that they don't get fused and so they remain open. Vertebral is the name given to the column of bones that covers the spinal cord. Most severe forms of spina bifida occur at an approximate rate of 1 in 1,000 births globally. Milder forms usually come without symptoms and are incidentally diagnosed. My guest on today's show is Dr. Abidemi Oseni. Dr. Oseni is a senior registrar in neurosurgery at the Lagos University Teaching Hospital. You're welcome to the show.
Thank you very much.
I've talked about the formation of the bones of the spinal cord. They don't form properly, so there's an opening. But what about it is spina bifida?
Well, like you already said, it's a congenital anomaly, and what we mean by that is that during the developmental process, when the baby is still inside the womb, certain things may go wrong, and some of the things that may go wrong, this is an example. And the spinal cord itself, that is a column of nerve tissues, is housed within the bone. So in spina bifida, there's a defect with the bone, with the skin overlying the bone, and in most severe forms,
the skin that overlies the bone, what's that skin called?
The regular skin. You can't touch, there's a skin on your back, so you can't touch the vertebrae. You don't see the vertebrae. So the whole layer from the skin down to the nerve, which is the spinal cord, may get involved in a very severe condition. Don't let's forget that the spinal cord is like a hollow tube. So in spina bifida, it kind of open up like a book instead of coming together to form a cylindrical structure. So that's what happens.
Do we have classifications of this spina bifida?
Yeah, we have various classifications for spina bifida. The most common one is we classify it as spina bifida occulta or spina bifida cystica. In the occulta one, which is just Latin word for occult, that means it's not visible. The skin over it, yes, the skin over the defect is normal. The only thing that may prompt you to it, you may just see a tuft of hair on that side or a dimple at the back of the baby. So some people will take that as, oh, it's a birth defect. So, but if a clinician examines the back, it's possible for you to feel the bony defect. So, but in this case, it's a mild form.
Does that hair always show out?
It's not in all cases. You could see the hair. It could be just a dimple, just like, why is this child having a dimple at the lower back? So that may prompt you as a mother, well, something is not right, or just see hair is supposed to grow on the head of the baby, and just examine the back of the baby, just
and hair is coming out.
Yeah, that's some of the things that you may point to that there's something else down there. So if you want some tests, you just see that the bone is not totally closed, but the spinal cord itself is normal in such instances. And most of these children with the occult types described, they grow up to be normal. They usually don't have any issues. The other arm of it is the cystical one, in which from birth you just see a swelling on the back of the baby. And at times, people that do regular ultrasound scan during their pregnancy, it's possible for it to have been picked up. Say anything.
What's in that swelling? Isn't it because something is inside that sac at the back?
Inside that swelling, what you have is that the spinal cord opens up. So there's just a thin membrane that covers that aspect of the spinal cord, and the CSF accumulates.
So it's actually
cerebrospinal fluid, which is like a lubricating water for the brain and the spinal cord. So it just accumulates and is walled in by a thin membrane. So in that cystical form, there is no skin, proper skin over the spinal cord. There is bony defect. That means there is loss of normal vertebrae over that segment. And also the spinal cord itself, instead of being a hollow structure it's supposed to be, is now open up like a book. So those are the problems in this.
What's the effect of the spinal cord being opened instead of closed?
Okay, for those babies that have the cystical type, which is a severe form, the effect is that anything below that level, there is little or no innervation to the level below where the damage is. That means that the formation of the spinal cord sort of ends at that problem. So the development is arrested. They are called hypoplastic nerves. So you find those babies, usually their lower limb looks thinner than normal. They, in very severe forms, depending on the level, some may not be able to walk, some may be able to walk with walking stick or walking aid like braces on their legs. So
when there's a problem with nerve formation, doesn't that mean that there will be loss of feeling?
Yes. There are different nerves. You have the sensory nerve, you have the motor nerves. So if you happen, for example, you have a baby with myelin at L4, L5 level, these are clinical classification of the level of the abnormality. That means anything below L4, L5, the patient will not be able to feel. The innervation to all those parts below that level is affected.
Okay, so the disability or problems that occur will depend on where the problem is.
Exactly.
How many levels do we now have this problem occurring at?
Okay. Spinal bifida can occur at any level, right from the base of the neck down
to the
tailbone. But most commonly it occurs in the lower back, the lumbar region. That's where most 40% of spinal bifida will occur at that level. So the commonest one we see tend to occur in the lumbar region. The most challenging ones is the one that occurs in the thorax, that's the upper back. Because when we want to repair, you don't have enough tissue to cover, but we still repair. Those ones that occur way lower down, that's in the sacral region, they are less, they are rarer, if I can say that. It's possible that because that's towards the end, the child may actually escape any form of neurologic deficit, so to speak.
Okay, so is it possible that nobody will even notice there's anything there?
No, you may notice it, but the nerves have already exited from the spinal cord. So you still have that wall of CSF, but there is no untrapped nerve root or anything. So if you repair it, you find that the child is seemingly fine, no issue, but at death, you have that swelling way back just above the buttocks. So that's a possibility.
But I'm curious, why would this kind of thing happen to a child? You know, we were told that usually if there's going to be any malformation, genetic trouble that's going to be of any consequence, the child gets spontaneously aborted by the 3rd month. So most of such children wouldn't happen.
Well, it's not in all cases. Congenital anomalies have they come in various forms and various severity. Spinal bifida is a congenital anomaly quite well, but it's not life-threatening, so to speak. You can't compare it to a child with a 2-chambered heart or 3-chambered heart. Everybody has 4 chambers in their heart, so that's a life-threatening situation. So life-threatening congenital anomalies may be spontaneously aborted. Some congenital anomalies are not compatible with life. The fetus will just get aborted. But in this particular case, it's not life-threatening. It gives you a whole lot of disability, but it's not life-threatening. So
don't you think
get born with it.
1 in 1,000, the statistic 1 in 1,000 is pretty high.
I actually feel it's underreported because...
Oh, you feel it could be more than that?
Yeah, it's actually more than that. Because what happens is that most of mothers, they don't know what it is. Quite a number of them never present themselves in the hospital. The statistic you quote is for Western world. Most of the work on spinal bifida will be done in the United States. And
but is it a global statistic?
It's a global statistic, but you have positive data from our own environment. I'm sure you can't, to the best of my knowledge, I don't think there is a veritable statistic you can quote for Nigeria. Okay. We see quite a lot in my institution. At least on a weekly basis, we get 2 patients admitted with this condition.
Okay, so is this an inherited thing?
No, it is not inherited, it's not sexually transmitted, it's a congenital anomaly. So certain things predispose to it, but it's a failure of developmental process in the baby.
At what point in the spinal cord would give the child the worst case scenario, the worst condition?
The worst condition during developmental process, the spinal cord gets formed by the 3rd week. The anterior neuropore gets closed. That's technical term for the upper end of the spinal cord gets closed at 22 days. The posterior one by 25th to 27 days. At this point, even
when you say 22 days, 25 and 27 days, what are we counting? Okay.
After fertilization. So at this point,
everything is formed before 3 months.
Yes. In fact, at this stage, the mother is not even aware that she's pregnant. So that takes us to the next question, like, how do you prevent? What did I do wrong?
How do we prevent this? There is a way of prevention, I suppose.
Yes, you can't prevent it. Studies have shown that in as much as we don't know what exactly causes it, certain factors have been shown to be attributable to its occurrence. Like, one of the major factors is that mothers that have low folic acid level in their body are predisposed to having children with spina bifida. So most cases we advocate folic acid supplement for women. And when we know in our environment, people say, oh, I start taking folic acid when I register for my antenatal.
And by that time,
it's already too late.
Already formed.
Yes, it's already too late, because most people, even the oldest person that will register for antenatal in India, probably about 4 weeks or 6 weeks after missing their period.
So when should the woman begin to take the folic acid?
The WHO advocates that all women of childbearing age should be on low-dose folic acid supplementation. And what we mean by low-dose folic acid supplementation, they should take 0.4 milligram.
And that's how many?
Per day. That's a tiny little tablet every day.
That little yellow one, yes. Is that the way it is everywhere in the world? Yeah,
it comes in 2 dosage formulations. For the general populace, people that are not pregnant, people that are not ill or under any, what they need is a lower dose, which is 0.4 milligram. There's another formulation that comes in 4 milligram. When the person is now eventually pregnant, there is more demand for folic acid or during disease conditions. So you step it up to 4 milligram per day.
Okay, so that little yellow tablet is the 4 milligram one?
Yes.
So how do they get the 0.4 milligram? Is it available?
It is very, very much available.
If you were to go to a pharmacy, yes. What would you ask for? Low-dose folic acid?
Just say you want folic acid, you want the preventive one. So, or get your regular family physician to prescribe it for you is 0.4 milligram.
Okay, now we have the dosage. Yeah. Let us specify what is the childbearing age.
Well, in Nigeria, the legal age is 18, so childbearing age would be anybody from 18 to menopause.
Because you see,